My name's Dr Jason Chinnappa and I'm a specialist orthopaedic surgeon, mainly dealing in hip and knee surgery. I was happy to help make this information video for patients so that they could get a better understanding of some of the costs that can be involved with using their private health insurance. The main goal of the initial first specialist appointment is to try and find out what's brought the patient to see the specialist. What are their symptoms? How are they bothered by it? And what would they like done about it? Now, if the diagnosis is known, management options could include non-surgical treatment or surgical treatment options, and these will then be discussed with the patient. If the initial diagnosis is unclear, then a discussion will be had on how we might get to the bottom of what the problem is, further workup that might be required, and then a follow-up consultation arranged. People need to know that using their private health insurance doesn't automatically mean that there's no out-of-pocket costs for their treatment. Private health insurance doesn't contribute to outpatient consultations such as the initial specialist consultation, although patients may get a rebate from Medicare to contribute to that. When using your private health insurance for surgical treatment, there may also be out-of-pocket costs involved. The out-of-pocket costs can vary and often depends on which insurer you're with, as different insurers provide different amounts of rebate for different operations, which adjust surgeons' fees accordingly. The exact amount of that cost can vary, but is usually decided on a case-by-case basis for most surgeons. Surgical quotations are usually provided in a written format so that the patient can read it in their own time and process it in their own pace. Things to look out for are date of surgery, location of surgery, surgical description, and also the Medicare Benefit Scheme or MBS item numbers involved for the surgery. The patient should check that these item numbers are covered in their health insurance. There are varying levels of health insurance cover, and not every level of cover will cover every procedure. So that's a discussion that you should have with your insurer once you've received the quotation. The medical costs finder may help patients get an idea of the sums involved in using their private health insurance in terms of out-of-pocket costs. This might help them aim towards savings goals or not be in shock when they get their first consultation quote, so that they can focus more on their treatment and their recovery without the additional burden of finances coming as a new surprise to them.